Hello, good evening. My name is Renee Gomez, and today I will be giving my presentation over rabies. What is rabies and its causes? So, rabies is a slow, progressive zoonotic disease caused by a virus in the Rabidoviride family in the genus Lysovirus. Wild animals such as raccoons, foxes, skunks, and bats are typically the primary reservoirs for the virus, but it can be spread to and through domestic animals such as dogs. A rabies infection is typically caused by contact with saliva, bites, scratches, or inhalation of droplets from an infected animal. This image here shows us what the rabies virus looks like. It is characterized as an enveloped bullet-shaped virion. Symptoms of rabies. When an individual gets infected with rabies, the virus first multiplies at the initial trauma site. And then because it's a neurotropic virus, it will enter the nerve endings. And from the nerve endings, it will spread to the ganglia, spinal cord, and brain of the host, eventually resulting in encephalitis. The infection cycle of rabies is complete once the virus successfully multiplies itself in the salivary glands of the host, which is why it is spread through saliva. The rabies infection itself progresses through 4 different clinical phases, and each phase has its own characteristical symptoms. The first stage of a rabies infection is the prodromal phase, which during this phase, it's hard to distinguish that a person may have rabies because the symptoms are so similar to that of the flu. And so those symptoms include having a fever, a headache, vomiting, nausea, and there will be a tingling sensation at the wound site. The second phase is the most commonly associated with rabies, which is the the furious phase. It's called the furious phase. In the furious phase, the symptoms are agitation and aggression, seizures, twitching, and hydrophobia. Phase 3 of a rabies infection is the paralytic phase, where the host goes through paralysis, disorientation, and stupor. The stupor symptom causes, the host to become dumb, and so this is also why rabies is known as like the zombie disease, because it's like the closest infection virus there is to what a zombie would be. And of course, the last stage of a rabies infection results in coma and eventually death. These images here show a dog that's infected with rabies, and unfortunately this man who also is suffering from a rabies infection. If you could see this picture, a full screen of this picture, it would show the man restrained to his bed because of the symptoms and the pain. There's nothing they can do. And this brings us to how rabies is diagnosed. So unfortunately, there are no current tests that are able to diagnose a rabies infection in humans. Therefore, bites from wild animals, stray animals, or even possible exposure to rabies requires immediate medical attention. Rabies infections are indicated by the presence of Negri bodies in nervous tissue. And obviously, these can only be found in autopsies. And this image here is what a negri body looks like. This is nervous tissue with negri bodies, which indicate a rabies infection. Next, brings us to how rabies is treated. As stated previously, there are no tests that are able to diagnose rabies ante-mortem before death. So the only treatment available for rabies is PEP, which is post-exposure prophylaxis, and it's preventative therapy. And this treatment, this PEP, consists of passive and active immunizations given at the same time. The wound itself is infused with human rabies immune globulin and globulin. Then, a human diploid cell vaccine is given in 6 doses with 2 booster shots. The transmission of rabies can be controlled through the vaccination of pets, animal control, and quarantining practices. Number of cases in the U.S. Due to the preventative therapies that are in place for any suspicion of rabies, there are very low cases reported in the U.S. However, rabies cases are still reported, but they're reported in very low numbers. For example, only 1 to 3 human rabies cases are reported each year in the United States. And although less than 10 people die from rabies in the U.S., it is estimated that at least 100,000 people get treated with PEP. Now, are the charities dedicated to rabies? As we've seen in the last 2 slides, rabies is fatal. There's typically no survivors of rabies. So the charities and organizations that I found are only dedicated to the prevention and eradication of rabies instead of aid for victims. For example, the Global Alliance for Rabies Control is this organization here. Their statement says they work to stop suffering, fear, trauma, and death, and build a safe future for the next generation to enjoy, where animals and humans live together in safety and harmony. This organization receives donations for vaccines, which are then used to vaccinate dogs, because dogs are the leading cause of rabies in underdeveloped countries outside of the U.S. VetCorps and Rabies Free Africa and Mission Rabies are 3 other similar organizations who perform the same kind of work as the Global Alliance, and they vaccinate dogs while also educating at-risk populations. These are my references. Thank you.